Newborn and neonatal health in Garissa County has received a shot in the arm after the county set up its first ever oxygen processing plant. Parents with preterm babies for a long time have had to resign themselves to fate or pay a very high price because the Garissa Level 5 hospital previously didn't have oxygen and were forced to buy from Nairobi, inevitably passing the high cost to patients, many of whom could not afford. But as Mary Muoki reports, the county now boasts of a 27 million shilling oxygen processing plant with a capacity to supply the hospital's oxygen needs and enough to share with nearby hospitals.
When Halima fell pregnant, she knew she would name the child Hudayfa, Arabic for companion of prophet. But her dreams were almost dashed when she went into labor early and was rushed to the Garissa Level 5 hospital. At 32 weeks, her baby was born preterm and with lungs not fully developed enough to breathe on his own. Baby Hudayfa developed severe respiratory distress and needed oxygen to breathe, necessitating a hospital stay at the newborn intensive care unit at the Garissa Level 4 hospital.
And I have been here for 12 days now. Thankfully, my child's condition has improved significantly. Previously, he experienced breathing difficulties and nausea after consuming milk. The healthcare workers in the vicinity have been incredibly supportive, although there are instances where we have to venture out and purchase medications ourselves.
The little boy can now breathe by himself and requires close monitoring every 20 minutes. Abdirahman Adan, the clinician in the NICU in Garissa County Referral Hospital, says children like Hudayfa who are born before 39 weeks have undeveloped lungs and therefore require additional oxygen to give them any fighting chance in life. The clinician says the hospital sees babies like Hudayfa all the time and receives newborns from as far as Somalia.
It plays a major role in issues of respiratory distress mostly, as it helps the child's now breathing pattern to normalize because the lungs can't support itself. So the CPAP machine mostly it helps us now to do away with issues of hypoxia mostly. And now what happens, the child breathing patterns normalizes and the child is out of distress and saturations becomes normal.
The oxygen processing plant, funded by the Rich in Impact, Saturation and Epidemic Control RISE project that's funded by the United States Agency for International Development, will save the county $600,000 used for the purchase of oxygen every month. In 2022, Garissa County recorded 1,098 preterm babies that were admitted to the newborn intensive care unit at the county referral hospital, with varying medical challenges arising from their weight and complications from birth. At any given time, the hospital's NICU has at least 17 babies in a ward with a maximum capacity for 20. The county has the highest maternal mortality in Kenya at 672 deaths in every 100,000 live births. Prior to the installation, the county would buy oxygen from as far as Nairobi, and many patients would die gasping for breath. Speaking during the official launch, Garissa Governor Nadhif Jama said that working with US aid and other non-profits is a useful strategy that counties can adopt to attract support to augment the county's investment in building fragile health systems, especially in the northeastern front.
This is a very much needed medicinal intervention. Ambaye haikuwa hapo awali. We are now slowly becoming a level 5 hospital, a proper level 5 hospital where we are able to provide the most essential services.
Garissa Level 5 Hospital has a catchment area of about 2 million people and not only attends to patients referred from health facilities within the county, but also those from neighboring Tana River, Kitui, Isiolo and Wajir counties. Mary Muoki, Citizen TV.